How do organ transplant teams cope with tough decisions? Imagine being part of a team where every choice could mean the difference between life and death. That's what transplant teams face every day when deciding who gets a new organ. These decisions are not simple. They involve weighing medical facts, ethical principles, and social factors all at once. It's a complex process that requires careful thought and teamwork. First, teams evaluate if a patient is medically ready for a transplant. They look at the person's overall health, how well their body might accept the organ, and whether they can follow post-transplant care. Psychosocial factors matter too, like if the patient has enough social support and understands the importance of medication adherence. These assessments can be subjective, so teams work hard to reduce bias and encourage honest opinions from everyone involved. They often use decision-making frameworks like consensus or majority rules to make fair choices. When a donor organ becomes available, the team must decide quickly if it's suitable. They check if the organ matches the recipient's blood type, size, and health condition. They also consider how long the organ can stay viable after removal, which is usually about 4 to 6 hours for most organs. The team communicates closely with organ procurement organizations to ensure everything is ready for a timely transplant. To make these decisions more consistent, hospitals now use data-driven tools that help evaluate risks and benefits. These tools help reduce variability and improve success rates. Ethics play a big role too. Teams aim to maximize the overall survival chances while ensuring fairness in who gets an organ. They consider barriers like transportation issues or financial difficulties that might affect a patient's ability to follow through with treatment. Sometimes, they have to exclude candidates if they believe the person cannot manage post-transplant care properly. In the end, transplant teams relying on a mix of committee discussions, clear medical guidelines, ethical principles, and new decision support systems. These elements help them handle tough choices with fairness and compassion. Over time, this process has grown from early experimental surgeries into a well-organized system that balances medical progress with moral responsibility. It's a key milestone in the history of science and health, showing how far we've come in saving lives through innovation and careful decision-making.